Thanks a lot, everyone, for coming and participating in this seminar today. I know this is the second seminar of the week and maybe people are tired. But let me introduce Dr. Ahmad Tafti. It's my great pleasure to introduce him. So he's an assistant professor of computer science at the University of Southern Maine, where he is leading the USM AI Research Laboratory. He is also an advisory board member in Stanford Deep Data Research Computing Center within the School of Medicine at Stanford. Dr. Tafti received his PhD in computer science with an emphasis on artificial intelligence and 3D computer vision. He is passionate about AI and its applications in healthcare. Dr. Tafti is the 2021 SIIM Imaging Informatics Innovator Awardee, Mayo Clinic Transform the Practice Awardee, an NVIDIA GPU Awardee, and GE Healthcare Honorable Mention Awardee. To date, he has authored more than 45 peer-reviewed publications. He has organized numerous workshops and tutorials on intelligent health and has served on the program committee of more than 15 conferences, symposiums, and journals in AI and digital health sciences. So he will give us a talk on explainable AI in medical image analysis, lessons learned in total joint arthroplasty research. The stage is yours, Dr. Ahmad.
Thank you. Thank you so much. Hello, everyone. And first and foremost, thank you for having me with you. And it is my absolute pleasure to be with you today and present my presentation entitled Explainable AI in Medical Image Analysis, Lesson Learned in Total Joint Arthroplasty. And thanks for the nice introductions. So my today talk, I actually start with HEGS AI, what and why. So the research laboratory we are having at the University of Southern Maine. I will start with that, and I will continue my talk with some sort of recent advances in AI-powered medical image analysis. And I will continue my talk with two main messages in AI-powered medical image analysis and also explainability utilizing computational vision. And I will finish my talk with showing and demonstrating how we can make AI models explainable and somehow interpretable for medical image analysis with focusing on case studies in total joint arthroplasty. So first of all, let's talk about HEGS AI Research Laboratory. So the laboratory we are having at University of Southern Maine. First of all, HEGS AI stands for Health and Explainable AI. So yeah, Health and Explainable AI. So the common goal and main purpose of our laboratory is actually to promote basic and also applied research to make healthcare better through the power of explainable AI. And within our research laboratory, we are actually trying to attempt to address three main questions. So one is actually how advanced explainable AI models are developing in healthcare community. And the second one is actually how the explainable AI model can change healthcare system and also how they impact healthcare community. So our team in HEGS AI Research Laboratory, we are actually having multidisciplinary team. We aim to provide high quality education in AI-powered healthcare informatics at all levels ranging from K-12 to undergraduate and also to postgraduate level, including postdoctoral degree, to actually develop highly skilled workforce for main economics, main financial, and also social development. So common actually methods and common interests within our research laboratory is actually to evaluate and generalize interpretable AI models, also to explore how explainable AI impacts the healthcare community, and also how we can augment AI explainability towards interpretability, towards a bigger umbrella. We can call it, you know better than me, we can call it responsible AI in healthcare. So here you can see that two main research projects. We are actually now working on them at the HEGS AI Research Laboratory. So one is, we call it computational orthopedics. So in computational orthopedics, we are actually developing natural language processing and computer vision algorithms to harness medical images and radiology reports and clinical notes are related to orthopedics, ranging from different settings, including, for example, shoulder, hip, and knee, image analysis and radiology report analysis. We are also trying to develop some sort of smart and advanced AI components to tackle the problem of in-home elderly care using artificial intelligence methods. What I'm trying to say in terms of in-home elderly care, let's say, for example, privacy preserving AI to detect elderly, people activities, daily activities, including maybe, like sitting, reading books, getting assistance, maybe some sort of adverse events, for example, falling, using thermal cameras and depth cameras or kind of, fused deep learning strategies. And this is the URL of our research laboratory. Again, Hex AI Research Laboratory. You can find us hexai.github.io. So starting from this slide, I'm trying to go deeper into the main focus of this talk, which is about explainable AI in total joint arthroplasty. Before that, I would very much like to highlight recent advances we all have seen in terms of AI-powered medical image analysis. In doing so, I would like to start with 3 main papers recently published in the community. They are all talking about recent advances in terms of utilizing and developing deep learning computational vision strategies in medical image analysis. So one of the publications recently published in Health Data Science Journal entitled Advances in Deep Learning-Based Medical Image Analysis. In this paper, so we can see a summary saying that overall, and according to the best available evidence, deep learning models perform well in medical image analysis. So the second study I would like to highlight that is this one is actually provided by Harvard scientists, and the paper entitled Comparing Performance of Deep Learning Strategies or Deep Learning Convolutional Neural Network with Orthopedic Surgeon on identification of total hip prostatitis designed from plain radiographs. So this work actually summarized that the convolutional neural network achieved the same or even higher performance than at least one of the surgeons in identifying 8 of 9 total hip replacement implant design, but underperform all of the surgeon in identifying 1 total hip replacement implant design. So the last study I want to highlight in terms of recent advances in AI-powered medical image analysis is this one, which is about explainable deep learning models in medical image analysis. And we can see that they concluded deep learning methods have been very effective for a variety of medical diagnostic tasks and have even outperformed human experts on some of those, but the black box nature of those algorithms has restricted their clinical use. So if we want to summarize these 3 papers recently published in the community, in scientific literature, I was able to actually grab 2 main messages from these 3 papers. So the first message we learned that it was the story is and, the story is not or. What I'm trying to say is that within those recent papers, so we can see that deep learning computational vision and surgeons. So we always need to keep domain expert in the loop. We always need to keep human in the loop. So what I'm trying to say is that deep learning computational vision and surgeon and radiologists and physicians, not or physician, not or surgeons. This is the message number 1. Message number 2, we can actually extract it from these kind of papers. So is this. So while scientific progress or progresses in deep learning computational vision and pattern recognition has achieved advanced modeling strategies with almost human-like performance, however, they are all limited in their explainability and interpretability. So number one, we need to sit together to think what is the rationale behind AI-powered decision-making. We call it, you know better than me, we call it explainability. And the second one, we also need to think what is the meaning of this AI-powered decision-making, how we can interpret those models. So explainability and also interpretability are going to be two main keys. We need to think about that, and we need to come up with some sort of solutions and strategies to tackle that. So before I continue my presentation, I would like to stop here and just briefly compare rule-based strategy versus learning-based strategy, at least in computer vision, and then try to compare explainability within rule-based strategy and also learning-based strategy. So imagine we want to make a computer vision model to help visually impaired people to do a simple task. Let's say, for example, to distinguish steps from doors, right? So with the use of AI components, we can put that kind of AI components in Raspberry Pi, for example, in embedded Google Glass, something like that, to help visually impaired people to distinguish these two objects from each other. So the first thing we need to come up is actually define the singularities, right? So how we can define singularities to make these two components, these two entities different from each other. So we as human, if we look at these two different objects, so we can perhaps define some sort of singularities, saying that if this is a stair, we can see a list of horizontal line in the stair. But if we want to distinguish door, then in doors mainly, or actually basically, we can see a list of much more vertical line in the door. So what I'm trying to say is that in defining singularities, we can account for rule-based algorithms, we can account for learning-based algorithms. So if we want to actually decide to go to rule-based algorithms, so it's going to be very straightforward. Just for example, we can take an image, and then we can turn their RGB image to a grayscale image, and then we can crop the part of the region of interest we are interested to distinguish objects from each other, and then do the contrast enhancement and do edge detection. So in terms of rule-based strategy, then the rest is going to be really easy and straightforward, saying that so we can turn the image into the Fourier transform and then try to find the maximum intensity in the Fourier transform and sum them together and put a threshold. Let's say, for example, if the threshold is bigger than one specific, kind of measure, then it's going to be, the summation is going to be a stair, otherwise it's going to be door. So even though the strategy and the singularities we define is somehow simple and straightforward, but since it's a rule-based strategy, we may get stuck in defining, in characterizing this object, for example. As you can see in this example, we will see a list of horizontal lines, but we all know that it's not going to be a stair, right? So it's a screen. And also this one, we will detect it with at least with the use of this algorithm, we will detect it as a stair, but it's not a stair. So in contrast, or at least in comparison to learning-based strategy, we can also account for learning-based strategy and most recent advances like deep learning and machine learning techniques in computational vision. In doing so, we only need to come up with an object pair and also pictures. You know better than me. Let's say, for example, we have door and image 1 JPEG, image 1 PNG, things like that, and steps, image, whatever. So we can come up with the list of objects and also picture as a pair. Defining that, we can come up with a very straightforward example, directory, including a list of images that all are covering different stairs from different illumination, from different angles, from different materials. So, and we can also, create another folder, another directory, including different doors with different, diverse model. So here we can see that in learning strategy, we can account with more diverse model, at least in comparison with the rule-based strategy. So with that, I would like to now, at the moment, we can compare explainability using those kind of strategy. So in this slide, you can see two axes here. So one, we call it model explainability, and the other axis, we call it model accuracy. So if we actually, we want to start with the rule-based model, as we discussed, and as you saw one example recently in this presentation, rule-based model can be easy to understand, so can be very easy to explain. So, and come up with the rule, actually demonstrate the rule, illustrate the rule to the audience, to the end user, to the developers. But we all know that model accuracy is not going to be that much good. So if we want to go further and come up with the statistical models, so statistical models tends to come up with more accuracy, with much more, reliable performance in terms of accuracy, precision, and recall. But we will lose some sort of explainability. So to explain how it's going to work and how machine or how a statistical model can define those kind of, decision making. So if we go further down or further up, actually, so we can account for machine learning models. Using machine learning models in comparison with the statistical model and rule-based models, we will gain better accuracy, but again, we will lose explainability. And more recently, deep learning, or of late, deep learning models, we all know that we have seen a lot of progress. We can see that, so deep learning strategies have already demonstrated very successful application in a variety of domain, and with a high performance, with high accuracy. But again, explainability is really challenged to actually clearly understand what's going on under the hood. So as part of computational model explainability, so if we want to develop a computational model, which we want to make it explainable model, we actually, as computer scientists, need to tackle three different challenges. One, we call it model interpretability. The other one is model transparency. And the last one is, like a trust to the AI models. With model interpretability, we need to come up with ensuring that AI powered or AI enabled decision making is actually natural. And we cannot see biases, or we can't see biasness in the prediction. So model transparency, we actually need to make sure that we are differentiating the false causality from true casualty, and also enable real-world decision makers like our surgeons, our practitioners, our nurses, at least in healthcare community, to actually and to really to indeed trust AI-powered models. This is our task. This is in our shoulder actually to tackle those kind of challenges. So, and explainability objectives in computational vision or computer vision models. So we need to come up with AI-powered model explainability aims to achieve actually trust. So, and also correlation. The other one is identity, fairness, reliability. And so in terms of trust, we actually need to convey confidence in the model to our end users. End users could be practitioners, end users could be surgeons, end users could also be our patients, right? And also healthcare providers like different hospitals we are having in our community. So we also need to come up with correlation to capture correct correlation or capture correct association between various features we have within images, within medical images and target classes, for example. And also we need to respect identity, like preserve privacy, preserve security, preserve identity of our patients, our people in the healthcare community. And also we need to, very careful about the fairness, be fair and ethically compliant in terms of different data, in terms of different patients. So for example, we want to, end of the day, we want to make a model, generalized AI model that can, cover a range of different ethnicity, different age, different gender, in terms of patient characteristics and at least patient demographic characteristics. Reliability is one of the, the key components as well to come up with confidence in AI-powered models. So our surgeons, practitioners, and patients could be confident to rely on the AI models we are developing actually. So we talk about explainability in computational vision. We also talk about, what kind of task we need to come up to develop explainable AI model in computational vision community. Now we want to see how, right? So we did see what is explainability and why we should bother this. And within this slide and moving forward, we need to see, or we want to see how we can make this happen. So in a very bigger umbrella, if we want to classify computer vision explainability into different categories, so we have three main classes, three main different strategies to make computer vision models explainable. One, we call it example-based strategy. The other one, we can call it textual-based strategy. And the last one we call, not least, so we can call it visual-based strategies to make AI models or AI medical image analysis models explainable. So in the rest of the slides, I would present, example-based and also visual-based kind of mechanisms to make AI models explainable in medical image analysis. And textual-based, so I will be more than happy to actually to have you discuss that, beyond this presentation. So it's going to be beyond the scope of this presentation. So before I actually present example-based and also visual-based strategy, I would like to say why total joint arthroplasty research is important to us, at least in the United States, at least in KUIS AI Research Laboratory. In this slide, you can see some sort of significant, you can see some sort of facts we are having in United States in terms of total joint arthroplasty. So the first fact you can see here is actually orthopedic surgical procedures, including total knee arthroplasty and total hip arthroplasty, are the most common and fastest growing surgery in the United States, with almost 1.3 million total joint arthroplasty procedures occurs on a yearly basis, and more than 7 million Americans are now living with artificial knee and or also artificial hip joints. And you all know better than me, so total knee arthroplasty and total hip arthroplasty is not only for old adults, it could be also for young athletes. So we are having two kind of, actually people, they are suffering from this kind of disease and some sort of, complications. So the second fact you can see here, the widespread adoption of X-ray images, the widespread adoption of, generally speaking, knee and hip radiographs, including X-ray images, CT images, and also MRI images, and also their availability at low cost, make those kind of images very principal methods in assessing, in analyzing, in evaluating total joint arthroplasty, and also associate complications including bone lucency after surgery, bone loosening after surgery, infection, fracture, those kind of things. And the third fact you can see is that so analysis of those radiographs is still highly subjective. It depends on radiologists, it depends on surgeons. But at the end of the day, we need to develop, we need to make these kind of, mechanisms basically, objectively kind of objective kind of strategy, not subjective kind of strategy. And the challenge we have is that so overlapping structure within the radiographs and also large volume, very large scale kind of images we have in a daily basis. So this makes the task very overwhelming for our surgeons. And the other fact is that, so you perhaps know that 80% of those images, they don't have any complications. They are very normal knee, they are very normal hip, meaning that we are wasting our surgeon times, we are wasting our practitioners' time, our radiologists' times to look at somehow nothing, right? So that would be great. And there is a pressing need to actually develop AI components to at least come up with triage, those kind of images, saying that, okay, these 80% images, I as a machine cannot see, or I'm not seeing any complication on those images. But the rest, which is 20% of those images, there is some sort of complications. And we need to sit together with domain experts, with surgeons, to come up with better understanding, better analyzing. So, and the last one is with growing number of total knee arthroplasty and total hip arthroplasty patients, at least in the United States, the routine radiographs follow-up remain an overwhelming task for healthcare providers, for most orthopedic centers. So, and let's look at the kind of research activities. We are interested in doing total joint arthroplasty, generally speaking, within TJA Research Laboratory and within our group, multidisciplinary team. We are actually interested in delivering of effective musculoskeletal care and improvement outcome of patients within different categories. One, safety of hip and knee replacement implant. So you know that there is a list of concern in terms of long-term safety of the total knee replacement and total hip replacement due to the metal debris we could have in the blood that may cause some sort of cognitive decline, that can cause some sort of heart failure in a long-term period, not in a short-term period. And the other one, we actually interested in developing natural language processing and computational vision algorithms to do data abstraction, to develop explainable AI in orthopedics. And also we are really interested in determinants of clinical outcome and cost in total joint arthroplasty. What I mean is that we are really interested in finding correlation and association between patient characteristics, clinical heterogeneity, and also, what is going to have, like a worse outcome, and what would generate, like a cost-effective outcome or better clinical outcome in terms of treatment strategy, in terms of prognosis strategy, and in terms of detection strategy. And we also really interested in doing translational research, meaning that we would very much like to transform orthopedic imaging into the clinical practice. So saying that, end of the day, we could have machines to do and to assist actually, our surgeons to do their surgery, to do their analysis in terms of medical image, the analyzing and interpretation. So, and the research significant, as we already discussed, is actually population. We have in the United States burden of total joint arthroplasty. It's very significant to us. So, and there is a high translational potential in clinical care, and also there is a high translational potential in research activity, and also translation of benefits to our patients. So patients will receive a list of benefits, including, their insurance, so we can turn long-term hospitalization into short-term hospitalization if we can develop some sort of AI models to tackle those problems. And these are just few, benefits we can provide to our patients. And now let's look at how we can develop explainable AI model in total joint arthroplasty with at least 3 or 2 different, examples. So in this slide, you can see a general or very generic X-ray, the images X-ray machine will generate. You can see that our X-ray machines will generate basically these kind of images, but end of the day, our surgeons, our practitioners, they are actually interested in this region of interest, right? So to find, for example, some sort of bone loosening here, bone lucency here, perhaps some sort of infection around the total knee arthroplasty, and things like that. So what I'm trying to say is that, so our X-ray machines, they are generating this image, for example, right? But end of the day, our surgeons are interested to look at this one, right? So meaning that in a very simplest way, we need to develop AI components to tackle 2 main problems. One, in terms of localization, right? Localization of the region of interest, which is, we call it knee joint area, right? And the second one is classification, classifying this region of interest into, for example, this is total knee lateral view, not AP view. So, and this is another example. Again, this one is generated by our X-ray machine, but again, end of the day, our surgeons, they are really interested in region of interest we can see here, right? So, a region of interest we can see here, right? So, but what I'm trying to say that we want to develop AI algorithms to localize knee joint area and accurately, precisely classify them into knee. For example, this is knee AP view, and this is TKA AP view. So, and in terms of example-based strategy, I was telling you I will present example-based and I will present visual-based strategy to develop explainable AI models in medical image analysis. So in terms of example-based strategy, here is the thing. So let's say, so we actually developed AI model, and end of the day, we wanted to provide it as an explainable AI model. So we actually, with example-based, we are trying to provide as much as example we can provide to our surgeons, to our clinicians, to our practitioners. Example of true and also example of false prediction, false classification of the prediction actually made by our machine, by our AI models. So we actually provided our surgeons and practitioners a list of examples. Example of, for example, total knee arthroplasty from AP view, and also total knee arthroplasty from lateral view, normal knee from lateral view, normal knee from front from AP view, and check whether our surgeons, our practitioners, they agree to see what they see, they agree to the results they can see, and also come up with confidence level or intersection over union in terms of the bounding box our machine generated using the deep learning model, and also classification results saying that this is AP view or this is lateral view, for example. And you can see that we published the work recently. At least we actually published it submitted into the archive. So the work is publicly available, freely available at archive repository. And we are having this paper under review in Orthopedic journal. And the clinical significance of this work is actually about pre and post-operative knee surgery. So within the next example, I would very much to highlight some of our works in terms of visual-based computational vision strategy into medical image analysis, and particularly for total knee arthroplasty. So here in this work, we actually wanted to distinguish 4 different implant types using only plain radiographs. So, and the clinical significance of this work was actually in terms of knee revision surgery. So when our surgeons, they want to do revision surgery for a patient, first of all, in preoperative surgery, they actually need to understand and to know exactly the implant type of the previous surgery. And imagine for some sort of, cases, urgent cases, let's say, for example, a patient could have some sort of accident in a city in which when they have that patient into a, surgeon room, into the emergency care, they don't have access to her or to his medical records immediately. And they want to do the surgery very quickly. So meaning that we need, as computer scientists or AI scientists, we need to develop AI models that can only utilize plain radiographs to understand the type of the implant for that patient. So we actually developed AI models with the use of fused actually deep learning strategy to come up with some sort of, like distinguishing at least 4 different type of implant using plain radiographs, including Attune kind of implant, Sigma, Tritalon, and Persona. So, and here you can see in terms of visual base, we actually, developed mechanism to come up with some sort of, feature map and also heat maps, saying that if our machine wanted to decide whether implant type is Sigma or it's not Sigma, so we developed a strategy to show to our surgeons that machines will look at this side mainly. We look at this side mainly. We look at this side mainly to say that this is the implant type of Sigma, as distinguish this Sigma with other, type of implants. Or if our machines want to distinguish, for example, this is the Tritalon kind of implants, they mainly, our machines or our algorithms, they mainly look at this part, which is the stem of the implant, or perhaps this one for persona, which is the stem of the implant, to distinguish it from the rest of the implant type. And again, as we learn, at least at the beginning of this presentation, we learned that we always need to keep human in the loop. Even with visual-based strategy, we actually had our surgeon in the loop, right? So you can see that we actually, prior to that, we actually asked our surgeons, we gave them the raw image of this guy, and we asked them, if you as a surgeon, if you as a practitioner, you want to distinguish this image from this image, which part of the image will take more attention from your side? And for example, they said, for example, this side and this side. And we also, after developing AI model, we also had results generated by machine, and we only need to analyze level of agreement between our surgeons and level of agreement, between our surgeons and the machine for different type of the implant. And we actually achieved high accuracy and high measurement in terms of level of agreement among our surgeons, among our practitioners, and also our machines. So with these two examples, and with all like a quick presentation, I would like to thank you again, and I would like to stop here, and I would be happy to take any question you may have. And thank you all. And this is my contact information, so I would love to be in touch with each other. So you can see two of my emails. My email is ahmad.palavan@main.edu. You are, of course, very welcome to contact me with another email, tafti@ieee.org. So I will stop sharing my screen, and I would be more than happy to take any question you may have. Thank you so much. I appreciate your time.
Thanks a lot, Ahmed. Does anyone have any questions?
Yeah, I can have one actually.
Yes,
Yeah,
Burak.
Hi, Ahmed. Thanks
Hi.
for the presentation. Mine is, rather than being a question, it's just like a comment about example-based explainability. I think the way that people, actually human beings, explain something is based on rules. I mean, but the good thing about or the the big potential in human beings is that we can generate new rules pretty easily, pretty fast. So it's not like a fixed set of rules. So I find efforts to turn AI models into explainable AI models from a purely mathematical point of view, like trying to track some coefficients or looking at attention maps and things like that, a little bit off the focus. I mean, they are something else. They are not they are not the type of explanation that we seek, actually. That's something else. I mean, we should be referring to some sort of rules or generating new rules. In this respect, I find the example-based explainability or explanation a much better or promising approach, at least in the short term, because I mean, as you said, the MDs should be in the loop, and when we actually provide those examples to them, they can do the final stage of processing, final stage of explaining, actually.
That's very true. Yeah.
Having said that, my final comment is that when we are working on example-based explainability or example-based things, what I miss most, that I have been trying to focus on, but I cannot see it in other research groups as well, is that people are trying to, for example, retrieve similar examples from past cases so that the MD can give some comparative assessments. But those similar cases are usually done in the scope is very narrow in these similar cases. They either find the same diagnosis, for example, or same body part. But actually, we should not be looking for similar cases to retrieve. We should be looking for relevant cases. And relevancy is different than similar, because there could be something that has nothing to do in terms of the diagnosis or anything, but it could be the negative sample. It could still be, helpful for explanation. So
Very
I
nice comment. Very nice comment. Yeah, Burak. Yeah.
So that's that. I mean, that was my comment. I just wanted to verbalize it. I just wanted to talk over it. Just we should focus on relevant case retrieval, or relevant case identification, or relevancy check, or things like that. There's a case here that I would like to give a decision. What is relevant for this case?
Yeah, yeah, and try to, as you truly mentioned, try to update. Maybe it will end up with some sort of updating with the rule. So and the rule will be updated continuously with the use of new relevant kind of cases. Very good. Yeah, thank you, Burak. Yeah, it's very true. Thank you for a nice comment.
Thanks.
Any other questions? Maybe I can have one.
Yes, please.
So I'm working on NLP, and I'm mostly on the NLP side, and there is a trend going in NLP on interactive explanations. So I was wondering, because I guess it takes multiple turns to explain, and there should be some feedback loop from the human, and then feedback from the machine, and there should be some interaction. And I was wondering if there are any works on that, or do you see any direction in medical analysis?
Yeah, so actually as you saw in my presentation, my main focus and my main interest is actually in terms of medical image analysis. I personally don't do that much kind of research activities in terms of natural language processing and their application in clinical note analysis. But one thing I have seen, at least in terms of clinical domain, because I have been actively working in within different healthcare providers, including, for example, Mayo Clinic. So end of the day, the things we want to see and we want to develop in actually to have it actively in practice. You know what I mean? So patients and also healthcare provider can trust, can rely on those kind of models. So you truly mentioned about something about interactive kind of approach. Interactive, I think if I get it correctly, you mean interactive in terms of interactive model between surgeons and also AI models, and make it more reliable moving forward. Is that right? So
yeah, for instance, the model gives an explanation or segments the region, and the region, then the surgeon gives feedback like this part is correct, but this part is not correct. And then
that's right. To us, so the lesson we learned, it was actually a very heavy iterative kind of work, like a back and forth between our AI experts, computer scientists, and also MD people, our physician and our surgeons. So it's a very heavy iterative process, one after another, in terms of quantity of the data, in terms of quality of the data, in terms of the model we are developing. So, and they should, as I said in the beginning of my slide, so it's gonna be and kind of things. So the lesson we learn, is that, so it's an iterative process. So, and we cannot, at least we were not able to to immediately say that this is the rules, this is the strategy, this is the mechanism, and this is the results. Let me tell you just very simple, straightforward kind of example we have seen within our work. So we developed a model with the use of knife base to actually say actually patients, saying that within next 3 years, a patient needs total knee arthroplasty surgery or not, right, to do a knee replacement. Okay, so a knife-based model, the knife-based model we developed was able to say that, let's say, for example, better than me, with some sort of probability, 83%, this patient, for example, Ahmad, will need to do knee replacement within 2 years, right? So when we sat together with our physicians and also with our patients, so we know that patients come up with different knowledge from different perspectives. Perhaps they don't know that much about math. They don't know that much about statistical reasoning, right? saying that 83% doesn't make sense for a regular patient, for a common patient, to understand what is the probability to get a surgery after 2 years, 3 years, right? So our patients were telling us, so 83%, 84% doesn't make sense. I don't know. So you please tell me, end of the day, after 3 years, do I need surgery or I don't need surgery? You know what I mean? So it was some sort of, kind of straightforward strategy. We only change a little bit in terms of mechanism of the prediction from naive Bayes to something like a decision tree. You know better than me, decision tree can come up with 0, 1, right? So do it, do not do it, do it, do not do it. Then we were able to come up with better explainability for our patient, better interpretability actually to our patient, saying that, Ahmad, yes, within 2 years, you need a surgery. You know what I mean?
Yeah.
Yeah. So these are the lessons we learned, from our research activities I was able to share with you. And I hope it can help in some way.
Yeah, it was a really great talk.
Thank you.
Thanks a lot.
Thank you.
Do we have any other questions?
One question. So
Yes.
for the explainability and the interpretability, so it is like highlighting the image parts that are more relevant to the decision. And I believe that the medical doctors would like to see some parts that are consistent with their decisions.
That's right.
But, I would like to ask the question from a different perspective. So, for example, by using such kind of highlights, is it possible to discover some new practices or to find new explanations for the diseases? So what do you think?
So very, very nice, very good question, Shikdam. So let me tell you an example. So one of the research activities we did in the past, it was about knee osteoarthritis grading. Grade knee radiographs into different grades in terms of knee osteoarthritis level, for example, 1, 2, 4. So one of the things that our surgeons and radiologists can look at those knee radiographs to come up with the results saying that this is grade 1, this is grade 2. It's mainly based on the gap or the space they can see within the knee joint space, right? So if the knee joint space is somehow narrow, so the grade is, let's say, for example, 5, or the grade is, for example, 4. But if the knee joint space is bigger, so the knee gonna be normal, right? So when we developed AI models with the use of diverse data set we had at Mayo Clinic, we had at MMC, Main Medical Center. So we were able to develop, to actually provide them with some sort of visualization, heat map, kind of feature map to our surgeons. And we were able, not we, our practitioners, they were able to see the story is not all about the knee joint space. The shape of the bone, you know what I mean? The morphology of the bone also is very important to distinguish the knee osteoarthritis level. You know what I mean? Mm-hmm. So it was some sort of, how can I say, like, not actually new evidence, but it was some sort of information our practitioners and our surgeons need to consider prospectively, right? To have new patients. They did realize something from machine that they didn't see in the past, and they can establish a prospective research, right, Shikdam, to see whether the morphology, the shape, the structure of the bone, 3D, 3D model of the bone can have some sort of, kind of impact into knee osteoarthritis or not, which already demonstrated by machine. They do have some sort of correlation with the osteoarthritis.
Okay, so that's great to figure out such kind of new evidence. So
That would be awesome. That would be awesome if we can come up with some sort of new facts. So in that way we can highly impact clinical care for our patients, which is the main goal for all of us.
Yeah, you're right. So thanks.
Thank you. Thank you all
for your answer and the great talk. Thank you very much.
Thank you so much. Yeah. Again, I appreciate your time, and please feel free to contact me with any question. And again, I would love to collaborate with you guys.
Thanks a lot. Does anyone have any other questions? Or shall we close the session? Okay, if that's not the case, then I thank the speaker once more. Thanks for the very insightful and the great talk. And let's see what comes up from
thank
in
you
the
so
future.
much.
Yeah, very nice meeting you.
I thank you. I thank you so much. You have a very blessed day. Thank you.
Thank you. Bye-bye.
Thank you.
See you guys. Bye. Bye.
Bye, everyone.